Democratic Congressman Hakeem Jeffries, co-chair of the House Democratic Policy and Communications Committee, making him a part of Democratic leadership. Thanks for coming in on a holiday, sir.
Thanks for having me on, Craig.
Let's start with health care here, because you're familiar with the CBO score. CBO looking at the Senate bill saying that roughly 20 million fewer people would be left without health insurance come 2026. If repeal only were an option, if it were repeal only and then replace, how confident are you about coming to some sort of bipartisan replacement deal?
Well, I think that repeal only would be incredibly irresponsible. When we think about the foundation upon which health care has improved based on the Affordable Care Act, 20 million plus individuals now have affordable health care who previously didn't have it. Individuals, young people can stay on their parents' health insurance through the age of 26. That would go by the wayside. People are protected from pre-existing conditions. At least 50 million Americans would lose that protection in terms of individuals who now be vulnerable to being thrown off. Lifetime caps have disappeared under the Affordable Care Act. They'd get rid of that. Repeal only would be a complete disaster and would not be a foundation for coming to any bipartisan resolution.
I want to also ask you about this report out a short time ago. Steve Bannon, senior advisor there in the White House, reportedly, according to Axios, interested in pursuing this idea of raising taxes on the wealthiest Americans. Surprising?
Nothing surprising in terms of this White House, but it appears to be more of a diversion intended to distract perhaps from some of the mess that President Trump has gotten himself into in terms of his wild and irresponsible, out-of-control tweets this past weekend. There's nothing to suggest that this White House would pursue a policy of raising taxes on the wealthy or the well-off. That would go against the entire doctrine of Republican orthodoxy for the last 50 years, where they've done everything possible to jam tax cuts down the throats of everyday Americans in order to benefit, the lifestyles of the rich and the shameless.
You just mentioned the president's Twitter habit. Over the last 11 days, he has tweeted about, 5 days, he's tweeted about the media 11 times. He's tweeted about health care once. This was Health and Human Services Secretary Tom Price on Meet the Press yesterday. Take a listen.
The president's held multiple meetings within the White House itself with physicians, with small business groups, with other folks who have been harmed by Obamacare, with patients, individual stakeholders from across this land who tell him and have told us repeatedly that the current system is collapsing. The fact of the matter is that he can do more than one thing at a time.
Again, Health and Human Services Secretary Tom Price basically insisting that the president can multitask and that folks shouldn't be so concerned with what the president's doing on Twitter because he's still able to be an active participant in the ongoing conversations about health care reform in this country. What say you to that?
Well, there's no evidence that he's an active participant. The one thing that his Twitter behavior over the last few days have made clear is that there's a reasonable basis to conclude that he's not mentally fit for office. It's just not clear to a lot of Americans, not just Democrats in Congress, but people of goodwill all across the country, that this is the type of behavior and temperament consistent with someone who was the leader of the free world. As it relates to the health care debacle, what we are seeing in Washington is that Republicans have an unhealthy obsession with the Affordable Care Act. Some of these folks really need clinical intervention. The Affordable Care Act is successful. We should mend it, not end it, in terms of areas where we can improve upon it. But there's absolutely no basis for the conclusion that it has collapsed. And the president's rhetoric, both as it relates to other aspects of his Twitter obsession and whenever he decides to go at the health care reform efforts in this country, are totally irresponsible.
Your constituents are in New York, but I do want to ask you while I have you here about these pictures that surfaced over the weekend, pictures of the governor of New Jersey just over the river. There's Governor Christie enjoying some sunbathing there with his wife and some friends along a strip of beach that had been shut down to the public because of the budget shutdown, the budget showdown, partial government shutdown in New Jersey. When you see that picture, what do you think?
Well, this is one of the reasons why Americans all across the country have such a cynical view of our government, that individuals like the governor of New Jersey are holding himself to a standard that's above the things that were available to the residents of New Jersey. He closed down this particular state beach and other state parks all across the state as a result of this feud that he's in. And yet he takes advantage of the opportunity to sunbathe, presumably with friends and family, exclusively on his own. He's totally irresponsible. New Jersey residents can take comfort with the fact that his 8 years are up at the end of this year, and their long national nightmare will soon be over.
Congressman Jeffries, we will leave it there. Congressman, thank you.